Dr. Sameer
Okay.
is there. He's the first speaker for this session. He is available there.
Hmm.
Um, there's a slight change in the schedule. First, Dr. Natasha will say, and afterwards, Dr. Sameer will continue.
Okay.
Okay. I'll be
Natasha,
starting the session with the permission of the chairs. Namaste, good morning, good afternoon, good evening. Greetings to all the eminent experts and the presenters in the session. Welcome to the second day of poster presentation at LMHI Global Colloquium 2021. Due to COVID times, physical meeting were not possible. It's a great privilege and honor for all of us to come together at this virtual platform to interact with all. Posters presented orally here will also be available in the e-poster section of the virtual lobby, where speakers can interact with the participants. Participants are requested to be ready with their presentations and stick to the time limit. Thereafter, opportunity will be given to resolve any queries from the chairs. Theme of today's presentation session is case reports, observational, pragmatic, and randomized controlled trials. Sub-theme of this particular session is case report, cohort studies of psychiatric and neurological disorders. For this session, we have our two esteemed chairs, Professor Dr. Sarpodiler and Professor Dr. Niranjan Mohanty. Professor Dr. Sarpodiler, MD, PhD, CHTC Dean Home, is the Secretary General of the Lymphoma Association, board member of Birkanko Turkish Cancer Coalition. We have with us Professor Dr. Niranjan Mohanty. He is the Director, International Study and Research Center in Homeopathy. We welcome you, Dr. Sarpodiler and Dr. Niranjan Mohanty. Myself, Dr. Amrit Kalsi, and my colleague, Dr. Deepika Bhatnagar, are the moderators for the session. With the permission of the chair, shall we begin the session, sir?
Sure.
Thank you, sir. Now I request Dr. Deepika to invite the speakers one by one.
Thank you very much, Dr. Amrit. And I would like to invite our first speaker for today's session, that is Dr. Natasha Dinesh Naidu. She will be presenting an observational study for management of psychological distress in inhabitants of old age homes, an uncontrolled experiment study. So may I please welcome her for the session, Dr. Natasha.
Namaste everyone, greetings to all. My topic for today is management of psychological distress in the inhabitants of old age homes. It is an uncontrolled experimental study. So we see that with the improvement in technology and the medical facilities, the quality of life has improved and so has the life expectancy. If people would live up to maybe 40 or 50 years earlier, now it has reached beyond 60. And the same thing that we see, the trend is followed a little bit late in the developing countries like India as compared to the already developed nations. Now the question here is, why and what is the need to study this particular topic? Now, being a citizen of India, we see that there is a changing family trend and a family structure. Earlier, there would be joint families, but with progression, we see that there are more number of nuclear families. Children are moving away from homes for jobs or other reasons. So that increases the need for homes for geriatric residents. It is not only the escalating number of geriatric patients or population, but also the changing family structure in India. Now, when we hear this word geriatric, we always think of some physical ailment owing to the morbid gross changes that we can see through the eyes. But we also need to understand that there are also emotional and psychological changes taking place along with the age. So for this study, I chose 30 random residents from two geriatric facilities. They were all screened with the K10 and GHQ28. After doing so, a detailed case taking was done and the nature of the distress was seen. 2 of them were geriatric residents, 2 of them were non-geriatric residents. 2 of them were Two other tools were used to understand this, that is the diagnostic net and the TPD-TPR, that is the therapeutic problem definition and the therapeutic problem resolution. Now, the DINET helps us to understand through compartmentalizing the causes, that is whether the cause is social, whether the cause. So the results can be seen. All the 30 cases, the main causes were social and psychological, and the physical causes did not lag behind much. There were 27 cases where the physical causes led to emotional or psychological distress. Now, there have been many studies already conducted which have already showcased the psychological causes. But the quality of the psychological distress has not been assessed, which I have tried to do over here. In the psychological causes, grief, disappointment, anxiety, and fear were the main reasons. Now, after compartmentalizing this, we also see that there was an interlocking phenomenon between all the three spheres, that is the psychological, physical, social. For example, if there was any interpersonal conflict in the family or in the society, that again led to either grief or disappointment or anxiety or fear. Similarly, if a person witnessed some imminent loss or death in the family, again that gave rise to grief or disappointment or anxiety or fear, depending on what attributes or dispositional qualities each individual had. Now, psychological distress is a term which doesn't go directly to the diagnosis. For example, if I say that I have to catch a train tomorrow, I will probably spend a sleepless night today. Even this trivial stress is psychological distress. So in this particular study, what we saw in all the geriatric patients was that all 30 actually had some psychiatric diagnosis. That only indicates the severity of the psychological distress as we see over here. The pre and post assessment was done before and after 6 months, in which 26 residents out of 30 scored very high, that is more than 30 in the Kessler 10 scale. Kessler 10 scale
Not audible, dear.
is specifically designed for the homeopathic end. We see that now
Ma'am, please unmute yourself.
it is already unmuted. I'm speaking through my cell phone.
Yeah, you are audible now. Yeah.
Yeah. So after the management and the assessment, we see that 13 of them came down to a score of high level of psychological distress from very high. A total of 10 residents of the old age homes came to a moderate or a low level of psychological distress. So in this particular study, we are able to understand what is the quality of psychological distress, and hence we are able to address it. Like Dr. Hahnemann has already mentioned about taking a holistic approach, we see over here. Is my screen stuck again?
No, dear, it is visible. Perfect.
So we see over here that taking a holistic approach is becoming very similar to the BPS model and the diagnostic net. We are able to understand an individual at all the three levels, that is the physical, mental, as well as the social. All the three together form an interlocking phenomenon to give rise to a psychological distress. Thank you.
Thank you very much for your poster presentation, Dr. Natasha. I'll request the respected chairs to please ask her some questions.
Madam,
Yes,
this
sir.
this was conducted in a rural area.
Yes, sir.
Was there any home? This geriatric home was there?
Yes, sir. There were a total of 3 geriatric facilities, out of which we could reach out to 2.
Two. Okay. So the final conclusion is the seems to be very encouraging one. But what happened to study this case like this? How it is useful to this community now?
So the thing is that due to the increase in life expectancy right now, we see that the majority, that is the major chunk of the entire population, is actually becoming a geriatric population. So if we conduct studies more over here, we'll be able to learn what kind of distress they are facing, and hence we'll be able to manage that, because that is going to be the need of the hour. By 2050, it is estimated that about 2 billion people will fall under the category of geriatric population. So if we can be well prepared for that, it will be better for the humanity.
Much. Okay, thank you.
This is a good study. I congratulate you. I'm just going to ask, what is your next step and what are the implications you take out of this study?
So there were two things for this, and I have plans to extend this study further into one more thing, that is psychotherapy. Being a psychiatric resident in the hospital, we also see that along with the homeopathic management, I think psychotherapy will be very much helpful in this. But we need to study the different effect individually, whether it's only the homeopathic management or whether it's just the psychotherapy, and then both together.
Are there any take-home messages or what kind of homeopathy you use? Are there any common things that you can say for a couple of sentences, not too much, because we don't have much time?
Yes, sir, sure. The two main causes that were seen and expression seen in the study were depression and anxiety. So, making a totality accordingly, we saw that most of the cases either required remedies from the mineral or the plant group. Only one case required a serpent remedy. It was mostly related, the mineral remedies were mostly falling into the third or the fourth row, that is calcarea or natrum, because in all these patients, we saw that there was a lot of dependency. And the issues that we saw arose were not only in the old age home, but they were far before and earlier. That is either stemming from the childhood or during the young age or during the middle age. So the intervention needs to be done right since the beginning, not just when the person comes to an old age home.
Great, thank you.
Yes, sir.
Thank you, Dr. Natasha, for your presentation. Now I may please call upon Dr. Sameer Chokar for his presentation. It's a case report, which is scope of autism spectrum disorder.
Good afternoon, everybody. Good afternoon, Professor Sarkar, Dr. Mohanty sir, and the moderators. Is my presentation seen now?
Yes, sir. I would like you to.
Okay. So good afternoon, everybody. So today I'm going to speak on a very, very important topic, and that is autism. We all know that when a newborn child is born, I mean, when the child comes into this world, the parents are looking so much forward to all his movements, not only psychological, but also his physical movements, the crawling, the way he looks at you, the way he gives you the first smile. And imagine the plight of the mother and the father. And when they start looking at him, he does not look back to them. It is such a sad thing for these parents that the child does not respond to whatever they say. It appears as if the child is deaf. He is in his own world. He or she is in their own world. And that's a great tragedy for these parents. And this autism spectrum disorder, this is on the rise nowadays. So we have seen that in 10 years back, it was around 1 in 60, and now it has become 1 in 48 cases in children of psychiatry. There is this autism spectrum disorder which is diagnosed. So let's start with what is autism. It is a pervasive mental disorder appearing in the first 3 years of life. This is very, very important. Diagnosing early and catching them early is very, very important, because homeopathy has an excellent scope if you catch autistic children at the earliest. There is an intense developmental disability characterized by marked abnormal or impaired development in social interaction and communication. These are the two spheres where they lag behind. And there is a stereotype behavior. So you see that they are continuously doing something or the other, which comes again and again. So continuous stereotype, purposeless, monotonous hyperactivity with lack of interest. Okay. So what are the early signs what you see in infants? First thing is unusual visual fixation. That means you see that the child is fixed on something. unusually strong and persistent examination of object. He might look at a ball, continuously looking at the ball, continuously looking at the wheels of the car. Abnormal repetitive behavior, spending unusually long periods of time repeating an action, such as looking at their hands, rolling like this, rolling their fingers. Decrease interest in interaction. They don't interact, they are aloof. That's why autism, that means they are in their own world, they're lost in their own world. There is a delayed intentional communication. There is no effort on the child to communicate with others. He likes to be alone, doesn't mix up with other children. And lastly, of course, lack of age appropriate sound development. So delayed development of vowel sounds like mama, dada, tata. These vowel sounds they don't come up with. So some diagnostic tests are available in psychology, like CARS, the Child Autism Rating Scale, Autism Testing Evaluation Criteria, and Vineland Social Maturity Scale. Now, these three scales we have regularly used in our practice also, along with the help of a psychologist, of course. And these are important parameters for development. So just saying that the child has started speaking again or the child is developing eye-to-eye contact is not important. Evidence-based practice is important, and therefore reduction in the CAR score, reduction in the attack, reduction in the VSMS is very, very important in order to show the improvement in children. Okay. Now, when we look at the causes of autism, there are many, many causes. As such, autism, the exact cause is not known. But many of the causes are related to vaccination, infections, fragile X chromosome, and lack or excision of oxygen at birth. Now, something which I'm working on for a long time is also abuse in mothers. So, mothers' history during pregnancy has been very, very important. And in Turkey, where I'm seeing some patients regularly, there we have seen that mothers who were kind of abused, mothers who were not very happy during pregnancy, they had these kind of children, and that again takes us back to our Indian, psychology and Indian culture, that our mothers, after 7 months, they are sent to their mother's place, and then they're happy there. They're allowed to eat whatever they want. This happiness is very important. This happiness is not there in these mothers who have these autistic children. So this is the observation that I have made. And of course, we have seen that boys are more affected than girls. So boys are 4 times more affected. But what are the other things that these autistic children have is they also have communication disabilities. 15% have some genetic disorders like Down syndrome also. There is an increase in autism prevalence annually. They have intellectual disabilities also recurrent in families also, right? So I have a case study, a very, very nice case study in one of the many cases I had. This was Miss Ishani, of course, the name is changed, a 3-year girl. She spoke very few words and did not react to her name. No eye contact, very hyperactive, very irritable, did not sleep the whole night. And she would torture her mother. Her mother was actually tortured. Why? Because she always wanted breastfeeding. Even after developing teeth, even after being able to eat, she was not eating. She just wanted breastfeed, and she tortured her mother. So when the mother came to me so tired, and she said, "I don't know what to do with this child." She gets up in the night, she wants breastfeeding, and when she takes the milk, and when I touch her, then she throws me away or she pushes me away. So it was kind of a very irritable, selfish child, only wanting breastfeed like a parasite. The mother was totally devastated with this child, and since it was the only child, they could not. They were not very reprimanding also towards the child. They had to do whatever the child, and she was really, really sad. So once she feeds, she goes to sleep and does not even like anyone's touch. So based on all these things, and the irritability and the parasitic nature of the child, where she was completely dependent on the mother, at the same time torturing the mother, taking away all the vitality of the mother, and the rubric desire to be nursed all the time, I had selected Sanicula. And a few doses of Sanicula 30 and followed by 200 broke her habit of breastfeeding, also took away all her irritability. We did her CARS study, we did her VSMS, we did her ATEC, and all the scores were also coming good. So she's still under my treatment and she's doing really well. And the mother is also feeling better now, because the mother herself also was tortured, right? So when we look at the different scope of homeopathy, we are looking at how homeopathy helps in autism. So homeopathic medicines, they play a distinct role in reducing or eliminating autistic features by its action on psychoneuroendocrinal axis and psychoimmunological axis, which we already know. Second thing is, these children have either hyper excitability or hypo excitability. So what homeopathy does, it brings it to the moderation. So sensitivity to light, noise, touch, they are brought to moderation. It's not that we are numbing the child or we are making him hyper excitable. We are trying to bring him to moderation with homeopathy. Similarly, there are a lot of fears: fear of dark, fear of gravitation, fear of crowd. That's why we have also thought of many times we have given borax to children for fear of downward motion, with hypersensitivity to noise, that whenever they hear pressure cooker or even a plane flying by, they will keep their hands on their ears like this. So a borax was given to that child and it really worked wonders. Lastly, it helps to improve the motor skills as well as the perceptual difficulties, and it improves hyper irritability, hyperactivity, temper tantrums, injurious behavior, which is very, very important. So some of the remedies that I have seen in this study is that I have seen that calcareophos, I have seen around 19 patients, I have seen calcareophos working best in 6 patients, calcareous carb in 3 patients, tarantula again in 2 patients, medorrhinum in a patient, Staphysagrea in 1 patient, carcinosin in 2 patients, tuberculinum in 2 patients, and stramonium in 2 patients. So this was a small pilot study which I made right initially in my practice. But later on, I have seen that now I'm doing a advanced study of abuse in mothers with children with autism. So my summary of results after treatment is that there is an improvement in social interaction, sustained eye contact even with strangers, better appropriate facial expression, improvement in fine and gross motor skills, improvement in meaningful speech, reduction in anxiety, better interaction with peers, and better understanding and use of non-verbal cues. And lastly, I will tell you just I'll take 1 minute. My findings of autism in homeopathy is that I have been able to put them into 3 important things. One is hyperactive, kinetic, restless children, where I have indicated tuberculinum, tarantula, carcinosin, medorrhinum, belladonna, stramonium, senna, chamomilla, and anacardium, mostly used. Second type of autistic children are the self-destructive type, who try to injure themselves, bang their heads on the back. So lycinum has been very, very good. And the last are the regressive, which are going into the mentally retarded type, where hyoscyamus, buforana, and Baraita Kabe. So ultimately, my findings are that, remember, only a homeopath cannot do something. We'll have to work it as a team. So it is a synergy that works best. So a team of homeopaths, doctors, psychologists, educators, therapists, and occupational therapists is very, very important if we have to give the child the best results. And as I have said, we have to catch them early. Earlier we catch, earlier we can give them good results. Thank you very much for.
Thank you very much for your wonderful presentation, Dr. Sameer. I would request the chairs to ask the questions.
Doctor,
Go ahead.
you have very wonderful idea you have given. Achha, I want to clarify for myself that sanicula you gave for breastfeeding, to stop breastfeeding or breastfeeding. What happened to other group of symptoms of autism? Like suppose example, this delayed milestones, socially awkward child, and child who has trouble with the verbal, non-verbal communications. How did that improvement you would observe?
So sanicula was indicated on constitutional basis. It was not only given on desire to be nurse. Desire to be nurse was taken as an eliminating primary rubric, but otherwise irritability in children, biting, throwing things, aversion to be touched in children, all these rubrics were taken. So there was a proper repertorial chart, which of course, sir, I will share with you for your guidance for me. So all these symptoms, and as well as all the other modalities, that means the speech started. I mean, she was able to say something, she was able to talk, her irritability was reduced, along with of course the breastfeeding. She stopped breastfeeding. That was a very, very important thing. But there was a visible improvement, and she's still under my treatment.
So that is, you have taken some of the hyperactive symptoms.
Yeah.
So that is, I think ADHD is more visible, that symptom, rather than autistic child.
Yes. But her
how do deal with these 2 type of cases?
Sir, this child had features of ADHD also, because many a times autism children have hyperactivity also with them. But her other tests were done when we did CARS. She was in the limit of the autistic children, the mild to moderate.
Where shall I keep? Either keep under autism or autistic child, or under ADHD child?
No, can you say it again, sir? I couldn't hear. I'm sorry.
Suppose a child is hyperactive with the feature of this mentioned above. That will go under the autistic child, or it will go to ADHD child?
No, it will be under ADHD child.
Okay.
If there are no features of autism, I will not consider it.
Yes. So there is distinct difference between this autism and there is a high ADHD.
Yes,
So,
yes.
thank you, thank you, thank you,
Thank you.
thank you. Pass on to my professor.
Thank you, Dr. Mohanty. Samir, this is a nice presentation. My question would be, are all these cases receiving some sort of social care or psycho care? Because at the end of your talk, you said that this is very important. This is my first question. And the second thing is that autism is a spectrum disorder, and I know maybe more than 40 centers or doctors working on autism spectrum disorder with homeopathy. So what are the common things that you find, and what are the original things that doesn't cover with what others studying?
So the first question, I would like to say that what are the first questions? Sorry, that forgot, because I was concentrating on your second. The first question was, could you please tell me, sir?
Yeah, the first question is that are all these children in your city social
So
care or
all the children are under occupational therapists also. They are also seeing psychologists. We are a team of people here in Bombay, and all my children who come to me are referred to the psychologist for different psychological tests, because that is the parameter I use along with homeopathy. So I just don't give homeopathy and see the results, but I also first do before homeopathy and after homeopathy the results, and the evidence-based cure is there. So we are also looking at all the scores of CARS, ATTEC, and VSMS. And at the same time, yeah, and you talked about something which was original. So there are many people who are working on autism, and we need to work as a group actually, homeopaths. And I am with Dr. Barwale also, who's been my mentor at Spandan in Bombay, and he has done excellent work in autism. And I pay all my thanks to Dr. Barwale sir for teaching me whatever is autism, and I've learned whatever autism is from him. So we are working as a team, sir, and we are looking at all the symptoms of autism. And as I told you, I'm working at present on abuse or kind of disturbance in pregnancy and leading to autism. So that is what my future work would be.
So what is the original thing? I mean, at the end you said types. I mean, hyperactive, kindness, restless types, self-destructive type, and regressive type. Are those the original things that you come up with your study here?
Yeah. This is the study that I see, that whenever I see patients, I first group them. When a patient of autism comes to me, I group them whether he's a hyperactive patient, whether it is a slow learner, or whether it is a self-injurious. So my spectrum of remedy reduces. Of course, they are all mixed. Many a times children come to you with mixed pathology. That means he may be hyperactive as well as destructive also. So you'll have to see what is the major chunk of symptoms in that patient and treat it accordingly. Of course, we treat holistically, so we don't look at one symptom. I look at it holistically.
Got it. Thank you.
Thank you. Namaste.
Thank you, Dr. Samir, once again for your wonderful presentation. Now, may I please call upon Dr. Nikita Suresh Chandra Mehta from India. She will be presenting a case report on homeopathy as an adjunct therapy in a neonate with severe birth asphyxia with hypoxic ischemic encephalopathy, managed at a rural homeopathic hospital in Pargar at India.
Yeah. Can I start my presentation?
Please do.
Greetings to the chair and the moderators and everybody who is watching it around the world. My topic today is basically a case report of a neonate who came to us with severe birth asphyxia with hypoxic ischemic encephalopathy, and it was managed at the NICU of our rural homeopathic hospital in Palghar, India. We all know that homeopathy is very popular in the pediatric age group, but neonatology is an area of pediatrics in which we don't have too much of exploration of scope and limitations of homeopathy. So this topic was taken up to see what scope does homeopathy have in neonatology. The case which was come to us is basically of severe birth asphyxia with hypoxic ischemic encephalopathy, which is basically considered an emergency in neonatology because due to the lack of oxygen and blood supply to the parenchyma of the brain, it causes injury to that part of the brain, which is presented as neonatal seizures, respiratory distress, multi-organ dysfunction, which can lead to then failure, and long-term disabilities like cerebral palsy, epilepsy. Of course, there are standard NICU protocols which help the body to deal with injury and enhance the recovery. But all these protocols do have their limitations. So we also had a case which presented as day one full-term neonate. It had a history of obstructed labor where it was delivered. And when it came to us after 1 hour of birth, it presented to us with stage 2 hypoxic ischemic signs and symptoms according to the Sarnath grading. It presented with seizures, respiratory distress. There was right upper limb paresis because there was shoulder dystocia, and there was also gastric bleeding. The standard contemporary treatment was started after admitting the baby to the NICU, and the neonatologist's care was taken up. But after 12 hours of starting the treatment, the standard treatment, we observed that there was no adequate response and the recovery process had not yet initiated. At this point of time, we thought that can homeopathy help? Can it actually enhance the pace and extent of recovery in this neonate? And this was the time when homeopathy was introduced as an adjunct therapy. So when we need to give homeopathy to a neonate, we need to understand what is the clinical state at which the baby is right now, what is the stage of the illness. We made certain correlations between the clinical symptoms, the pathology of the disease, and the miasm through the evolution right from the birth till now. And we understood that there are certain pathological generals present in the case which helped us to formulate bogus totality, in which the most important point was that there was a sudden onset in an age group of neonates. The cause was birth asphyxia, which led to hypoxic ischemic injury. The tissues which were involved were brain, nerves, blood, because there was sepsis, and the mucous membrane of the GIT. The pathology which we see is injury, sepsis, hemorrhage. The modality which was very characteristic was convulsions were getting aggravated by touch. The convulsions had opisthotonus, there was right-sidedness, and it was changing in characters. Sometimes it was focal, sometimes it was tonic. And the cry of the baby was very characteristic, where it was a sudden, shrill cerebral cry. So on the basis of this totality, we came to the remedies like belladonna, cicuta, stramonium. Belladonna was selected on the basis of the sudden and the violence nature of the convulsions and of the pathology itself. Ailments from birth asphyxia in a newborn baby is a cause which is only covered by belladonna, while other remedies don't cover it. The right-sidedness, which was very, very characteristic, that the convulsions were starting from right side, was also only covered by belladonna. So belladonna was finally selected, and the susceptibility assessment helped us to understand that the baby is having moderate to high susceptibility. But we wanted a potency which was safe and which could be repeated often so that we can catch up with the acuity of the disease. And hence LM potency was selected, and we needed to halt the progress of the disease. And that is why a frequent repetition of 2 hourly was selected. Belladonna 0/1 2 hourly was given to the baby. And to our great relief, within 24 hours, that there was improvement in the neurological manifestations and the respiratory distress. By the third day, the right upper extremity paresis and the GIT bleeding and the intolerance improved. By 7th day, the contemporary medicines and oxygen were withdrawn gradually. By 8th day, baby was shifted on exclusive breastfeeding and complete recovery was there, and it was discharged on the 8th day. And after 5 days, it was called again on the OPD basis. And at that point of time, belladonna was stopped, and mother's constitutional remedy, Calcarea sulf 30, was introduced. Considering that the mother and the neonate are a unit, and hence there is definitely a relationship between them. And we can see that Calcarea is also a chronic remedy of belladonna, and that is why Calcarea was given to the baby. This case helped us to conclude that a simillimum, when it has a total similarity at the levels of cause, expression, pathology, and tissue affinity, not only helps with a case of structural pathology, but also in cases where there is guarded prognosis. It helps in restoration of susceptibility, it halts the progress of disease, and helps in functional revival, thereby hastening the process of cure. It was indeed a very heartening experience, and I would like to thank the Department of Pediatrics of Dr. Emil Dowley Memorial Homeopathic Institute to give me this opportunity, and to LMHI, thank you once again. I conclude my presentation here.
Thank you so much, Dr. Nikita. Once again, I request our dignitaries to ask her some questions regarding the poster.
Oh, Madam, I have seen your
Yes, sir.
institute. I have seen your institute, and
Yes,
you
sir.
are really people doing genuine work there. So I have no question to you. Thank you.
Thank you, sir. Thank you so much.
So my question would be, what's your take-home message? What's your next step taking from this point? And you have said you have improvements, neurological manifestations. So what has improved and how much improved would be my question.
Yes, sir. So the baby actually presented with neonatal seizures. There was hypotonia. The cry was not established. It was lethargic. It was not able to take up oxygen from the atmosphere. So at the end of the treatment, the neonatal seizures completely stopped by third day. After that, the tone of the body improved. The reflexes, which were very sluggish, the baby was lethargic. There was no sucking. All these reflexes, the primitive reflexes on which the baby survives, all of these were revived. So we can say that the functioning of the brain where it had got the injury was revived. Along with that, the other organs which were affected, like the GI bleeding. So the mucosa of the GIT was bleeding, which was then restored. The bleeding stopped. The baby started tolerating the breastfeed which was given to him, and it was able to suck also. The oxygen which was given from outside, that was also withdrawn, and now the baby was able to survive without any ventilatory or any oxygen support. So by the end of 8th day, all these functionings were revived. The multi-organ system functioning were revived, sir. And so my take-home lesson from this case is that there is definitely scope of homeopathy and role of homeopathy and in neonatology, and we can definitely help to halt the disease progresses, and we can lower down the duration of the stay in the NICU with the help of homeopathy. So that can help a baby to functionally revive earlier, and it can improve the quality of the life of the child. It is also important that the socio-economic burden of the person and the country also comes down when homeopathy is introduced.
So what you're doing is really great. So I would advise you to increase the numbers and try to get your study published with the details that you have given me as well, because this is why homeopathy is under radar, because we mostly don't give details of what we find. I mean, we cure people, but we need to give details and quantitation, and this is very important for the survival
Yes,
of homeopathy. And I congratulate you on your work.
yes, thank you. Thank you so much. Thank you.
Very nice presentation, Dr. Nikita. Thank you very much. Now, may I please call upon our next presenter, who is from Czech Republic. She is Mrs. Petra Kihlerova. She is going to present a case report on schizophrenia cured by homeopathy.
Hello to everyone. I just try to. You cannot screen the share while the participant are sharing. Okay. Okay. Hello. Screen. Okay. Okay. Hello, everyone. I am Petra Zilarova, and I am a homeopath from Prague. And I would like to introduce just one of my cases, which was a very nice case because it was case of a young woman which was cured by homeopathy from schizophrenia. So sometimes it looks like Homeopathy has no limits. No incurable diseases, no can't be cured at all. It looks like restrictions are just in our minds, and when we shoot our mind to prejudice, everything seems to be possible. One of the examples of my daring assertion is case of young woman, which I want to share with you. The first time I saw her in July 2020. Her father brought her to me. Even she was 29 years old, she wasn't able to come on her own. In her 19th, she has been diagnosed by psychosis with schizophrenia symptoms, and she was hospitalized with that. When she has came, she was under influence of strong psychiatric drugs, obviously out of reality. But let's start right from the beginning. This is her story. She was born as a third child, one and only girl, into the family with strict Catholic mother, who was the commander of the house. As a good little girl, she was tried to please mom as much as she could to deserve her love. She had fulfilled all mother's wishes and surprised her own needs and emotions down. She had never complained. She had never complained about it. In a little while, she had forgot to think about herself and what she wanted for her. Her parents quarreled a lot, and mother has moved straight to her room, and she stayed there even for the period of time when my patient became to a young woman. She didn't want to share a room with her mother, but she was scared of her, and so she didn't say anything to her. The same model of submissive behavior she practiced at the school. No wonder that other kids has quickly sensed her weaker point, and they had started bullying her. Quarrels and tensions at home, bullying at school, her life has turned into the hell. There's no surprise that she was ill very often. Inflammation of the middle ear or bladder had become alternated with migraines during of her whole primary school. Necessity to pleasant her mother and got just A on her school exams, transition on high school, more learning, unhappy love in her 14s, all of it culminate into the deep dark state. She hasn't been able to see anything positive in her life. Just learning quite often part the night, broken heart, quarrels, bullying. Her physical state had become worse and worse, and in her head had appeared a bad voice with constantly criticizing and blaming her for everything what happened. At the end, she believed that she is an evil and that she had caused all misdoing what are doing on around her. Her head had started boiling. She saw everything deprived. She had stopped eating and lost a lot of weight. The last year at the high school, she had been shut down to a medical hospital and started to take psychiatric drugs. Mustering all her strength, and she had finally graduated on high school and went to a university. She felt in love with a boy, but how it sometimes happen to be when someone isn't in a good psychic state, doesn't attract to the right ones, but just another disappointment. This boy wasn't a good choice for her. Anyway, she wasn't able to split with him, and long 4.5 years she had resisted in a bad relationship. She completely yielded to illusion that she is bad person and that she doesn't deserve anything good. In the matter of the facts, she had finally separated from him and she had gone to a pilgrim to Compostela. She has found a new boyfriend. He was kind, and she totally fell in love with him. She had started to live with him and eventually they were planning marriage. Everything seemed to be okay, but her disease has come back to her. At the time, she was just about to finishing university and too much stress with the university was going on. She wasn't able to concentrate to study and with all that emotions about falling in love was too overwhelming for her. Suddenly, all had become to fit into the old patterns. Fell into the wrongdoing and she was fooling herself with self-reproach. Coming through all of this, her head started boiling again. Thousand all at once. She had started blame herself or her boyfriend for that. From the huge pressure, she thought her head was just about to burst. After quarrel with her mother, she had another attack. She was sitting in the bathroom, body shaking and choking herself. After that, she was arguing with her boyfriend again. Her condition has deteriorated so much that she had seen a yellow monster instead of him. She couldn't recognize what is reality and what is only her imagination. These states of mind had repeated and she had become stressed out, fearful. She had had many of delusions without a normal life at all. Her boyfriend got terrified. He couldn't handle the situation with her. So she had moved into her parents' house in position of child which needs help again.
Mrs. Petro, I'm afraid we have to rush in a bit. We are running out of time.
Okay. So her father brought her to me. Analysis of the case. We see a little girl brought up strictly to obedience, which had been trying to please everyone so long that she lost herself and succumbed to delusion that she is bad so deeply that psychotic schizophrenia has developed. After treatment of psychiatric psychopharmas, her period stopped and she completely lost her joy, her will, and finally herself. And when we do repertorization, you can see there, the remedy which I gave her was Mancinella 1M. Follow up after 40 days after the remedy. Headache had almost gone, but voices in her head disappeared. She has had more energy. Last 2 weeks, she had felt much better and she had been more active, but still not self-sufficient. Follow up 1 month after the remedy. She had repeated remedy once after she had met her ex-fiance and definitely broken with him. She had felt much better than before. Her menstruation had come back and she had seems to have more energy. Step by step, she had set psychiatric drugs down. She had stopped blaming herself, no bad voice in her head, no fears. She had to look up for a flat to rent and move from her parents' house. Follow up on September. She had been fine, no need to repeat the remedy. She had gone to work, has found a new flat, goes jogging, enjoying friends without fears, no anxieties. She even started to communicate with her ex-fiance and she kept in touch. Follow up in October, she had been fine. She has a reunion relationship with her ex-fiance. She has felt happy, no headache, with regularly menstruating, good sleep, enough energy. Next follow-ups had become very similar, each other. Now she is happy and a contented young woman with no fears, no pain, no manifestation of schizophrenia. She is healthy, enjoying her life, and looking forward to get married with beloved man. Last time I repeated Mancinella was in January 2001 when she had a mild course of COVID-19. Last remedy I gave her was Silicia 30 because she had lost smell and taste after COVID. Within 1 week, smell and taste were back. Now she is happily married and got birth to a lovely little boy. So, Mancinella is the most poisonous tree in the world. It's called devil's apple. Fruits looks like ugly green brown apple and is enormously poisonous. It responds in homeopathic picture of the remedy, which is about evil. Patient feels as a pure evil to be possessed by evil spirits. It's a very unpleasant state of soul which this remedy is able to be cured. Thanks God that Hahnemann discovered homeopathy and we can help our patients such an elegant and gentle way. Without wishing to be unkind, I can't imagine how different should be life of this young woman if it hadn't been for homeopathy.
Much, Mrs. Petra. Thank you so much for your presentation. Any questions? No?
So, madam, you have given a wonderful history of a case. But
sorry?
You have given a wonderful history of a case.
Okay, thank you.
What are the home taking material for Mancinella symptoms?
Mancinella symptoms is the main remedy for the state when you think that some evil would want to catch your soul and if you think that you are evil. Yeah, it's usually becomes when you have very strict parents or something like that, or are you abused or something like that. And the state of the Mancinella is very dark, evil state. It's really horrible.
Okay.
Any questions? Just small digression from the main topic. We live in a crazy time when one disease was abused to create fear. Fear is the most dangerous emotion in a human being. As a homeopath, we have tools to dissolve fear, so we have to do it as much as possible. For many people, especially young and healthy people, is COVID-19 is not so dangerous as a vaccination against it, and it will be the main topic in the next year, I am for sure, and we have to be prepared for it, prepared to help people, and especially we have to fight for our rights to stop this dark, crazy times as much as we can. Thank you for your attention.
Thank you, Mrs. Petra. You had a lovely opening slide as well as the ending one. Thank you. Now I would like to invite Dr. Amrit to represent the remaining presenters, please.
I may now invite upon our next speaker, Ms. I.C. Lau from Hong Kong Association, China. She's going to present a case on autistic child with eczema, improved from homeopathic detoxification program.
Hello, it's okay? It's all right?
Yes, please.
Yes, okay. Hi, I'm Icy from Hong Kong Association of Homeopathy. And today I would like to share the topic with you is autistic child with asthma improved from homeopathic vaccine detoxification program. Here is the introduction of this case. A 4-year-old girl was diagnosed with autistic spectrum disorder with regression of development. The symptom appeared since 18 months old. She had a history of repeat reaction from vaccine. Now we can take a look of the medical history table. When she was 2 months old, she got the first DPT-IPV vaccine, and she got colitis with freckle bleeding. And then, when she was 6 months old, she got a booster dose of DPT-IPV vaccine, and she got her asthma. When she was 12 months old, she got the first MMR vaccine, and she got the recurrent otitis media. Unfortunately, when she was 18 months old, she got the third dose of DPT-IPV vaccine. But that time, she got a more internal problem. She lost eye contact, regression of speech, and started spinning in circles. Therefore, you can see this is the before treatment the photo. Before treatment, she had the asthma all over her arms and legs. And also, in the first consultation, there was no eye contact or a speech, and diagnosis was confirmed as autistic spectrum disorder in the public sector, with retarded speech development and selective mutism by doctor. And here you can see the picture this is the asthma before the treatment. During the treatment, because of the repeat reaction to vaccine, after consultation, vaccine detoxification with the specific homeopathic remedy was started. After taking the one oral dose of DPT-IPV30C, she got a period of emotional outbreak, fever, and a whole body aggravation of asthma. And you can see the picture over there. So after 2 months of treatment, parents and teachers in school all report an obvious improvement in her speech and social performance, and her asthma disappeared after the initial aggravation. In the follow-up session, she did not only show eye contact, she could also describe to the homeopath about her fear in brief sentence. She described a complete scenario of a room with dogs. Her parents also report that as her comprehension and verbal expression significantly improved, she also showed quite a domineering attitude towards family members. So she did not only speak, but also gave command. And in the whole case, there were no adverse reactions. And you can see this is the after treatment. As we know, vaccine injury is a controversial topic. Certainly, not 100% of vaccinated children survive from associated injury. However, clinically, we could observe cases of behavioral diseases as well as neurological diseases soon after vaccines, as pointed out by parents. Individuality should be considered, and homeopathy was famous for its helpfulness in vaccine reaction. Therefore, when a case had a history of repeat reaction from vaccine, we could start our treatment with the respective homeopathic remedy of the vaccine. A substantial improvement could result in many of these cases. There are different immunization programs in different countries, so we could target as the first vaccine that caused symptoms in that patient. This is an encouraged case, showing the potential of homeopathic treatment in children affected by vaccine. The demonstration of Parents' law is undoubtedly clear. Now we can take a look of this table. This is the Monarch criteria, and in these cases, there was an improvement in the main symptom for which the homeopathic medicine was prescribed. And in the direction of period, the case is following the Heron's law strictly. So the answer of the question 6 is also yes. But the old symptom did not appear during the course of improvement.
Apologies, please keep track of the time, please.
Also, we are not sure that there are alternative causes. Maybe there is nutritional therapy involved. However, the health improvement was confirmed by clinical observation. From the picture, we can see that the asthma was changed. After calculating, the score of this case is 10 out of 13. So as this is a chronic case and the score is 8 and above, therefore it can be considered to be identical case of a good causality score. And maybe I can tell you more is about the limited of these cases is we do not have a fixed method to record that kind of case. Maybe some information is not complete. And also this part we can modify it later in Hong Kong. And that's the end of my presentation. Thank you.
Thank you for your presentation. Now I request the chairs to ask any questions if they have.
Did you have any blood analysis or allergy susceptibility in this patient to support?
Sorry?
Did you have any blood analysis to show if this patient is allergic to something or any allergy spectrum that you have done so far?
No, we didn't have the blood analysis, but because in Hong Kong, we have the standard progress from conventional medicine. So the conventional medicine will have a general guideline, and we will follow the guideline to know that should diagnosis was confirmed as autistic spectrum disorder in the private sector.
Okay, thank you.
Thank you.
Any other questions, sir?
No.
Okay, now we thank you, Ms. Lu. Now we go on to the next presentation by Dr. Priyanka. It's by Dr. Leena Bagadia, and she's from India, and she's going to speak on the severe diseases of psychosomatic origin of their homeopathic management.
Namaste and hello to everyone. Can I share my screen, please?
Yes, sure.
Okay. Hello. I hope it's visible.
Your screen is visible, but you can enlarge the poster.
Yeah, I will just. Is it visible? No. Okay.
Now it's not.
Yeah,
yes, it is now.
Right.
You may further enlarge it.
Yeah, I'm enlarged. Yeah. So I'm going to talk about cardiovascular diseases of psychosomatic origin and their homeopathic management as a case series. Psychosomatic disorders are somatic illnesses caused or exacerbated by mental stress and distress. They are caused by the sufferer's mental processes instead of immediate physiological causes. The assumption is that with the different emotions that individual experiences, each disease manifests with a distinct set of symptoms in each sufferer, implying that every person has to be treated differently and not given the identical disease-specific medication. In nearly all cardiovascular diseases, the physical symptoms are concomitant with the psychological symptoms such as depression, feelings of discomfort, hypochondriacal fears, and acute anxiety. Following are the three different cardiovascular cases that are successfully treated with individualized homeopathy. And I am still following these 3 cases, and they fulfill the Naranjo criteria, modified Naranjo criteria, which is more than 8, the score. So now I shall first explain the psychopathology of a particular condition, and then I will describe the case. So the first case is about essential hypertension, where personality malfunction is unusually frequent. The general pattern of maladjustment in interpersonal relationships is considered to be either habitual, unexpressed, or displaced hostility. 2, lifelong emotional debility with frequent depression, anxiety, or anger, which is more often than not suppressed. 3rd, lifelong anxiety, perfectionism, compulsiveness, or difficulty with authority. Now I shall describe the case of a 40-year-old engineer working on a high tension post in a multinational company having essential hypertension with tachycardia, depicting cardiovascular hyperreactivity. He has a strong family history of hypertension, and he goes out of his way to be likable, is sparkling, bright, and with appealing manners, also sympathetic, responsive, and sensitive to others, establishing warm communication and rapport, never expressing his displeasure or anger. He will maintain good relations with people, especially those useful to him. He's very alert and curious, observing things once in the clinic, and he's also intelligent who can read mind of the opposite person. His BP, which was 160, 100, 110, and tachycardia, which was around 120, were successfully normalized with infrequent doses of phosphorus 200. I have written down the rubrics on a poster, so I'm not repeating them. This remedy even took care of his allergic rhinitis, which had been troubling him since his adolescent years. The next case is the case of coronary artery disease. Chronic stress activates the hypothalamic pituitary adrenal axis, and the autonomic nervous system's sympathetic branch reduces vagal tone, increases plasma catecholamines, elevates heart rate, and causes vasoconstriction, activating platelets and reducing heart rate variability. In addition, associated chronic increase in pro-inflammatory cytokines contributes to endothelial damage, plaque formation, atherosclerotic thrombosis, and vascular occlusion, and endothelial damage in coronary vessels. So now this case is of a 48-year-old shop owner with history of myocardial infarction, where the angiography, the first angiography, if you can see on the left, showed 75% blockage in 2 of the main coronary arteries, came for the treatment of uncontrolled hypertension despite taking 3 different antihypertensives. During case taking, it was found that though outwardly he projected as a carefree person, he always worried excessively about his shop, his son's future, and his parents' health. In addition, he is a very hardworking man, has a great sense of duty, and inherently devotional. He's a fundamentally capable, reliable, stable person, but now find himself discouraged after a theft in the house, and he felt very hurt at losing his old parents' savings and their unhappiness and sickness after the theft, and felt self-condemnation. Is intelligent but could not finish schooling, but he's very alert and wants to give his best to the community. But he thinks he's still not appreciated, very industrious. However, he had a strong sense of guilt, which landed him in self-contempt and worthless feeling. His hypertension settled with aurum metallicum 1M in infrequent doses within a couple of months. He continued the treatment till the COVID lockdown. After that, for more than 1.5 years, he was not on homeopathic treatment. Then in 2021 April, his elder sister died suddenly of COVID, to whom he was very attached. He had another episode of myocardial infarction, the second angiogram that you can see on the right. And his angiography incidentally showed the complete resolution of the previous infarction. So it was his cardiologist who advised him to restart our homeopathic treatment. So you can see the difference, see this was there, and now this here, it is all not there. So both the arteries, this is very clear. And he had another infarction because he was not on the treatment. So now these are the rubrics I have shown you. This aurum metallicum, and now I'm coming to the difficult case of supraventricular tachycardia.
The psychopathology is the brain-heart laterality hypothesis for SVT by Lane and Jennings. The lateralization of emotional processing in the cortex is conveyed ipsilaterally through the brainstem to the autonomic nerves, which are distributed in turn asymmetrically in the ventricular myocardium. An increase in the naturally occurring spatial inhomogeneity of repolarization facilitates the development of reentrant arrhythmias. In addition, sympathetic stimulation acting through beta-adrenergic receptors may be proarrhythmic through several mechanisms. So this is a case of supraventricular tachycardia in an 18-year-old girl whose grandmother also has the same history, who complained of sudden palpitation and heart pulsation in the neck, started after coffee and breakfast. Cardiogram showed supraventricular tachycardia with the rate of 155 to 160 beats per minute, and she was kept on antiarrhythmic drugs along with beta blockers and anxiolytics. But the rate did not slow down and remained same for 5 consecutive days. Hence, the cardiologist advised radiofrequency ablation the next morning, and she was about to get admitted, but her mother is a homeopath. She asked for my help, and we took her case, and her history goes like this. She is the only daughter staying with her parents, unmarried uncle and grandmother. Her parents have many differences and fights go on, occasionally in a loud voice. She's extremely scared of their loud noise and their neighbors' reaction. Her grandmother detests her mother.
Ma'am, apologies, the time is running out.
Yeah, just a last constant arguments go between them, and she's a bright student, and she was forced to computer engineering, but she changed it to cinematography. And she wanted to maintain her dignity at all cost, and a reserved child never weeps in front of others, and sun intolerance. She was given just a drop of Netramil 200 on her tongue, and she noticed a reduction in palpitation within an hour. She has sent me these on WhatsApp, the pictures of pulse oximeter. And within 2 hours, the rate came to 90 per minute, and the next morning it was 70, and the cardiogram was completely normal. So I just in conclusion, I want to say that psychosomatic diseases are multi-causative constitutional illnesses and dynamic in nature. When similimum is prescribed based on the totality of symptoms, it brings about the desired changes at physical and mental levels. And homeopathy is best to treat psychosomatic because it entails the totality, physical as well as mental. Thank you.
Thanks, Dr. Leena.
Yeah.
I request the Honorable Chairs to ask any questions if there are any.
No question, but Dr. Leena has given you a very beautiful presentation of the case.
Thank
and
you.
It is wonderful.
Thank you so much.
Appreciate it.
Thank you.
I also like the presentation and I congratulate you. It's just that, can you tell me how can you increase the quality of evidence?
Yes, sir. I have all, in fact, I have all the evidence. I have the cardiograms. I have the cardiologist documentation. I have the patients himself or herself talking about it. Actually, sir, I work in psychosomatic medicines and I have GI, asthma and all systems I have, but since it was here, I presented these 3 cases, but actually my PhD research is also on essential hypertension and anger. And there I am going to give an oral presentation on that. So there I have given all the evidence with statistical analysis and the proper, the standard deviation with confidence interval and everything. And here, all these 3 cases, I have this patient, the first hypertension case, I have asked for actually ambulatory blood pressure monitor, but the thing is they have got a blood pressure monitor at home, so it was home blood pressure monitor we were doing, and I have all the records written by them. And this angiogram, as I showed you, this patient also, I have all the blood pressure records as well as this. So in fact, I'm planning to write a paper on this, and will be giving all these details in that, because the poster is so small that we couldn't do anything much. I have, in fact, the cardiogram also of this SVT, the post, the next day cardiogram. That also I had, but I was really either I had to, write the rubrics or put a cardiogram. So I decided to write the rubrics.
I appreciate Dr. Bageti.
Thank you, Dr. Leena, for a wonderful presentation.
Thank you so
much. Thank you so much. Now I call upon Dr. Priyanka Keval Ramani. She's going to speak on exploring the remedies, types of interpersonal conflicts, and the emerging remedies, a prospective case series. Dr. Priyanka, you can share your screen, please. Is Dr. Priyanka joined in? Yes, she started her screen sharing. Dr. Priyanka, you are yet not audible, and you may start your video also. We are not able to hear you, Dr. Priyanka. No, you're not audible. You may unmute yourself. Still not audible.
Just a second, ma'am.
Now you're audible. Now you're audible.
Okay, okay. Is my screen visible, ma'am?
Yes, it is.
Yeah, okay. So, hello everyone. Myself, Dr. Priyanka Keval Ramani, student MD Part 2 from PS5 department from Dr. M.L. Dhavle College, Maharashtra. My topic for today's presentation is exploring the types of interpersonal conflicts and its emerging remedies, a prospective case series. So to start with introduction, in psychiatry, we see etiology of many psychopathologies originate from many past rejection, disappointment, hurts at many levels like social level, cultural level, revolving all around disrupted interpersonal relationships. These interpersonal relationships are an important aspect of our lives which enables us to communicate and understand other human beings. So healthy interpersonal relationships, they bring joy and satisfaction in life, while unhealthy interpersonal relationships, they develop conflict and negative emotion. It causes psychological disturbances that are not evident easily, but masked inside mind and may reflect on body with somatic complaints. So literature of our homeopathic Matra Medica is flooded with the symptoms of mind and various emotional states like anger, vexation, depressed state in many remedies and describes mental symptoms also from strained IPR, but inadequately explains that which type of conflict results in what state and which are the corresponding homeopathic remedies for it. So, objective of my study is to study the influence of different types of interpersonal conflicts on the choice of homeopathic similimum. Like this study is to see whether the different types of interpersonal conflicts influence the choice of homeopathic similimum. So in this study, 30 cases with IPR conflicts were selected randomly and validated using network of relationship inventory relationship question version. So this is an inventory. It employs a set of relationship qualities to describe positive relationship qualities and negative relationship.
जो मेरी thesis है.
So it is a 30.
Can everybody mute themselves because we cannot hear the speaker well?
It is a 30-item survey and 10 scales with 3 items per scale. This inventory, it assesses 5 negative relationship qualities and 5 positive relationship qualities. So this inventory was used to validate the conflicts in this study. Conflicts were then classified and remedies were prescribed on the basis of totality of symptoms. So we see that in our everyday lives, 4 types of conflicts are encountered, which are value conflicts, ego conflicts, policy conflicts, and pseudo conflicts. Value conflicts are those conflicts which involves disagreements on the deep-seated moral beliefs, like what is wrong, what is right, it is fair, it is unfair, what is just, what is unjust. So those are value conflicts. What are ego conflicts? Ego conflicts, it involves hurt to self-esteem. There is a winner and a loser in an argument. While policy conflicts, those involves a disagreement over a plan and course of action or problem-solving strategy of the situation. So those are policy conflicts. And pseudo conflicts, these are trivial issues, minor misunderstandings, disagreement, and perceptual differences. So these conflicts results in some or the other expressions on our body at various levels, which are at physical level, we see increased fatigue, poor sleep, diseases like migraine, IBD, neurodermatitis. At emotional level, we see depression, anxiety, suicidal attempts. At intellectual level, we see poor judgment, weakness of memory, and confusion. While at mental level, we see neurotic to psychotic behavior, defiant and hostile behavior also. So results which we got in this study are, we identified three types of conflicts, which are ego conflicts 66%, value conflicts 46%, pseudo conflicts 30%, while policy conflicts were not encountered in this setup of cases. These findings are non-uniform as more than one conflict was encountered in many cases. So here is table number 2, which indicates the homeopathic remedies which are indicated in ego conflicts. Remedies indicated in ego conflicts are acid phos, sepia, magmure, natrum sulf, natrum mure, kalicarb, lycopodium, staphysagrarium, murex, calcarea silicata, and fluoric acid. While table 3, it indicates the homeopathic remedies based on value conflicts, which are kalicarb, silica, pulsatilla, natrum mure, calcarea silicata, acid phos, sepia, staphysagrarium, and magmure. Table 4, it shows homeopathic remedies indicated on the basis of pseudo conflicts, which are silicia, calcarea carb, magmure, calcarea silicata, acid phos, lycopodium, and calcarea kalicarb. So, from these results, we see that mineral kingdom remedies were majorly seen in most of the conflicts, or we can say that all types of interpersonal conflicts are mostly seen in mineral group of remedies, followed by plant kingdom and then animal kingdom. Mental state was also studied in all the cases, and we saw that dissatisfaction was seen in majority of the patients, followed by brooding state, anxious state, vexed, depressed, indifferent, and in few suicidal state was also noticed. So to conclusion of this study, the clinical utility of this unique study is that homeopathic remedies could be prescribed corresponding to the types of interpersonal conflicts present in this patient. Also, as this study is limited till emerging remedies of interpersonal conflicts, this study could be explored further in view of remedy response. So with this, I would like to thank the chair and thank you so much.
Thank you, Dr. Priyanka. Now I may request the honorable chairs to ask any questions, please.
I congratulate again on your work, Dr. Priyanka. My question would be, did you have any measures taken to make sure that there's only one type of interpersonal conflicts which doesn't overlap between?
Yes.
Did you? Yeah. Go ahead.
Yes. So in this study, as we can see that the findings are non-uniform, because ego conflict was seen in 66%, while value conflict in 46% and pseudo in 30%. In many cases, we encountered a mixture of conflicts. I have not mentioned that, but we have assessed that in 20% of the cases, value plus ego conflict was present. In 10% of the cases, ego plus pseudo conflicts was seen, while one case was there where we saw all three types of conflicts were present.
Thank you.
Thank you, sir.
And Dr. Niranjan Mohanty, do you have any questions, sir? Sir, we can't hear you, sir. Sir, please unmute yourself.
Yeah. I'm happy that you have given a beautiful explanatory note on interpersonal conflicts and their indicated conditions. So, to my mind, I'd like to ask you one question. When we are treating a case of interpersonal conflict condition of any individual, then we have to take the physical symptoms or only depend upon the emotional and mental symptoms.
So in this study, we consider totality of symptoms while considering also the type of conflict present. Generals and particulars were also considered, but on the basis of conflict, we prescribed remedies. Yeah, considering the totality.
But you see, it is not the common symptom who denote the simillimum. It's the uncommon symptom which denote the simillimum. Therefore, if you take this and do not take the physical generals, we will see one aspect of concomitance. So thereby, our prescription may not be rational. Therefore, to my mind, it should be, we should take both the symptoms and evolve the peculiar symptom, and on that basis we should prescribe. This is my opinion.
Thank you, sir.
Yes, sir, yes.
Thank you, Dr. Priyanka. Now I may please call upon
Yes.
Dr. Dhanashri Jayant Bhalerao. She is going to speak on establishing the correlation of the expressions of anxiety in school-going children with remedy groups. It's a case series. Dr. Dhanashri, please unmute yourself so that we can hear you. We are still not able to hear you. We can see your presentation.
Dr. Dhanashri, please say something so we may know that you are audible or not.
You're not audible. You have to unmute yourself, Dr. Dhanashri.
Yes, you are audible, but the voice is very low. Can you increase the volume?
Good afternoon, everyone. The title of my study is Establishing the Correlation of Expressions of Anxiety in School-Going Children with Remedy Groups. So, anxiety as an emotion can limit an individual.
Ma'am, please put your microphone near your mouth.
Anxiety as an emotion can limit an individual from achieving full potential. The expressions of anxiety in pediatric age group change as the child grows older and the priorities of the child change. The various expressions of anxiety begin to unfold as the child is exposed to various environmental conditions under various factors like genetics, temperament, etc. As the representation of anxiety in children in homeopathic materia medica and articles is sparse, this study was taken up. Homeopathic treatment, when planned properly, can free the child from influences that sap energy, prepare the child for further development in life, and help in better adaptation. So in this study, children were screened using pediatric anxiety rating scale. This scale has two parts. First is the symptom checklist, and second rates the intensity of anxiety. So in this study, we had used only the symptom checklist provided in the scale, and 30 cases from 7 to 17 years of age who met the criteria for symptom checklist were taken up.
detailed case taking was done, and the expressions at the level of mind and body, both, and associated attributes were also elicited. The anxiety in each case was classified into different categories. The repertorization of the totality was done, and after all this was done, depending upon the frequency and intensity of categories of anxiety in each case, the group of remedies for each group was concluded. The group of remedies was studied in detail to understand the cause, expression, modalities, so as to facilitate better remedy differentiation. So coming to the analysis, in terms of proportion, the study has followed the observed trend of incidence of anxiety in pediatric age group. The commonest categories of anxiety seen was phobic anxiety in 39% of the cases, followed by social anxiety in 25% of the cases. Generalized anxiety was seen in 10% of the cases, while test anxiety was seen in 18% of the cases. Phobia was more common during the middle childhood, that is from 7 to 11 years of age, while in the adolescent age group, test anxiety and social anxiety was more common. Generalized anxiety was seen in the higher age group, around 15 to 17 years of age. So, social anxiety was studied under the following headings of fear of being reprimanded by the teacher, fear of being teased in public, difficulties in interaction with the teacher, and lack of assertiveness in expression of annoyance and disgust. So here we see that predominance of carcinosin and calcarea group is seen. In carcinosin, the fear of being reprimanded is the most prominent fear, while in contrast, in calcarea force, you can see that the fear of being embarrassed in front of everyone or being teased in public setting is more predominant. In generalized anxiety, carcinosin, laccan, calcarea iode, pulsatilla, and sepia were the commonly seen remedies. In case of carcinosin, the mental disposition of carcinosin, the sensitivity, the precocity, perfectionism, coupled with environmental factors like parental pressure, expectation from teachers, push the child towards development of anxiety. While in the calcarea group, especially calcarea iode, anxiety about health and avoidance of situation that aggravates anxiety was more prominently seen. In laccan, already the self-esteem and the confidence of the child is poor. The child is exposed to constant criticism, and the child starts to develop anxiety, and the expression of anxiety was about future, fear of being rejected, fear of failure. Coming to separation anxiety, pulsatilla, McFirst, calcarea first were the more commonly seen remedies. In pulsatilla, the typical behavior of clinging, kissing the parent, fear that the child will be left alone was commonly seen. To our surprise, both the cases of pulsatilla were male child. In specific phobias, calcarea first, medorinum, stramonium, calcarea iode were the more prominently seen remedies. Though there is only one case of stramonium, the intensity of the fear, that is fear of darkness, was the highest as compared to the other remedies. The type of fears were also different in different remedies. For example, in Laccan, it was fear of snakes. In Medorinum and Calcarea iode, Calcarea carb, the fears were accompanied with certain delusions. For example, if the child has fear of ghosts, there was a feeling that maybe someone is standing behind me, or from the crack the ghost will come and catch me. Fear after some ailments from fright was seen in lycopodium and opium. Test anxiety was more commonly seen in carcinosin, medorinum, lipo, and calcarea. The conclusion of the study is that the proportion, intensity, grouping of expressions of anxiety is different in each remedy. The cause, genesis, modalities, and associated attributes are necessary to arrive at a group of remedies. Thank you so much.
Thank you, Dr. Dhanashree. Now I call upon the esteemed chairs to kindly ask any questions.
Madam, you have dissected the anxiety very deeply from psychological point of view. You have also segregated all the symptoms present in the materia medica. But how are you going to plan to provide for the physicians to deal with them? Only a single symptom cannot be a totality. How do you like
that is
because it is, you have told rightly that it has varied degrees. Yes, degrees. So yes, unless there is a totality and we prescribe, yes, it will be helpful practitioners. You explain properly so that it will be useful to other people.
Yes, sir. Yes, sir. So that is why, sir, the associated attributes were also necessary to arrive at a final remedy, sir, in all the cases, sir.
You want to make it as a 153 aphorism as use this peculiar symptom? You want to use this symptoms you have obtained from the materia medica as 153 aphorism, uncommon symptom, and on that basis you like to prescribe?
Sir, I did not get your question.
Oh, you have not understood. Okay. Okay. Professor sir. Professor sir, you can. I hand over to Professor Saudin.
Dr. Dialer, you have any questions, sir?
I don't have any questions.
Okay, thank you, Dr. Dhanashree. Now I will call upon our last and the final speaker. He is Dr. Syed Ishad Ahmed Syed Kamruddin, and he's going to speak on deriving different homeopathic management strategies in cases of epilepsy. Over to you, Dr. Syed. You need to unmute yourself.
Hello, am I audible?
Yes, you are.
Hello, am I audible? Hello.
Yes, yes, Dr. Syed, you can start your presentation.
Yeah. Is the screen visible?
It is visible.
Okay. Good afternoon, one and all. So the aim of my study is to derive the different homeopathic management strategies in cases of epilepsy. In order to make you all understand this poster, I assume it is mandatory for me to explain why this topic was selected. In my extended family, I see one of my family members suffering from this distressing disease. These abnormal firing of the neurons not only make you disabled, but also it disturbs the quality of life of the entire family. As we all are aware, what is epilepsy? It is a condition of spontaneous recurrence of the unprovoked seizures, which are caused by hypersynchronous discharges of the neurons in brain. This disease is multifactorial and multi-causative, having its range from functional to structural irreversible level, whereby the inherent qualities of the individual to react to various stimuli is variedly different. Conventionally, epilepsy is treated by anti-epileptic drugs, but it seems the disease activity and the recurrence does not seem to reduce as expected because of its chronicity. Hence, there is a need of proper holistic approach to treat this distressing and disabling disease. Homeopathy being a unique science, it follows holistic and individualistic approach for management of patients suffering from this disease, considering their disposition, diathesis, as well as the susceptibility. So considering the different expressions of susceptibility in different individuals, there was a need to derive the different management strategies without compromising the actual individualistic requirement of the case to promote the quality healthcare. In this case series study, which was conducted for 18 months, we had selected 30 cases. In order to reduce the variability, we had taken generalized tonic-clonic form of epilepsy only as per International League Against Epilepsy. This league is working since last 120 years to fight back against epilepsy. In these cases, the 30 cases which were selected, we had done the remedy response evaluation where the remedy was critically evaluated after starting the homeopathic treatment. Detailed analysis and assessment was done in order to understand the data, which was to derive the most useful homeopathic management strategy with respect to remedy as well as posology, considering the susceptibility. The results which we had got was this: considering the abrupt onset and sudden onset of the disease, high susceptibility, sensitivity, and reactivity, with tubercular miasm as the dominant miasm, there were 24 cases having high susceptibility, whereas 6 cases had moderate to high susceptibility. When we see the remedial presentation, there were 18 cases out of 30 cases where the constitutional remedy was prescribed. Prescription of constitutional remedy selected upon the different expressions of mental symptoms and attributes, physical generals in particular, was the most useful and most helpful strategy in case of epilepsy, whereas we had 9 cases where the intercurrent remedy, tuberculin, was prescribed along with constitutional remedy. There were 3 cases where the acute phase remedy was prescribed. 2 cases were given cupramet, whereas 1 case was given Naxomica. And these acute remedies are prescribed upon the acute presentation of the disease. When we see the posological aspect of these case series study, we see out of 30 cases, 27 cases at the start of treatment was given 200C potency. And after 1 year of treatment, we see 26 cases still were receiving 200C potency. We see repetition of the remedy. Either 1P or 3P was prescribed, which are considered as infrequent repetitions. In all these 30 cases, infrequent repetitions were made before and after the initiation of treatment, considering the susceptibility, sensitivity, and reactivity of the patient to be very high. At the same time, tubercular miasm in the background. When we try to understand the frequency and duration of convulsion, we realize the frequency distribution table was made where we see there was 1 case where the patient was getting convulsions daily, 8 cases where the patient was getting convulsions quarterly, 6 cases monthly, 5 cases 3 monthly. And after doing the analysis after 1 year of treatment, we see the frequency where the patient was getting daily, it is now 0. Where it was weekly, it is 0. Whereas monthly, 6 cases have become 1, 3 monthly, 5 cases have become 4. And yearly, the frequency distribution table shows the yearly presentation has increased, whereas the daily presentation is reduced. At the same time, the duration of the conversion is significantly reduced. It was seen in the study that out of 30 cases, 13 cases, the doses of anti-epileptic drugs was reduced and tapered, consulting the physician. At the same time, 11 cases where the anti-epileptic drugs were completely stopped after consulting the physician. So with these results and analysis, what we have arrived is susceptibility plays an integral role in deriving the most useful homeopathic management strategies. Considering the high susceptibility, sensitivity, prescription of constitutional remedy in 200C potency in infrequent repetition was found the most useful strategy, which has brought about the significant reduction in frequency, duration of convulsions. At the same time, doses of anti-epileptic drugs were reduced. With this, I conclude my presentation. Thank you.
Thank you, Dr. Syed. I would request the esteemed chairs to kindly ask any questions.
Okay. So, the doctor, you have prescribed both the medicines, anti-epileptic medicine and homeopathic medicines. And along
Yes,
with
sir.
that, you got
According
results.
to the hello.
Okay. Your prescription
Hello.
was, whenever there is a case with the anti-epileptic drugs, you prescribe homeopathic medicines. Okay. With that, you
Yes,
got
sir.
result.
Yes, sir.
Whether-
The patients in their natural course of the disease were receiving anti-epileptic drugs, and we intervened with homeopathic drugs. And what we derived was the doses of anti-epileptic drugs were reduced over a period of time. When the expected requirement of the case was matched with a constitutional remedy, the doses were found to reduce. Patient was given initially anti-epileptics and gradually they were tapered.
How many days it took?
Sir, this study was conducted for almost 1 year, and the patients, in this case series, I have cases where the patient followed up for 1 year till 7 to 8 years.
No, 1 year is not sufficient, doctor, for this.
Yes,
case.
sir. Yes, sir.
Carry on this experiment for the more.
The duration becomes a barrier of this case series. I have realized this while doing this study.
Okay.
Sir, any more
My-
questions?
My comment would be, I mean, the objective of the study is correct, but you need to increase the number of cases and comparing the potencies and the duration of the study to come up with a concrete conclusion, because otherwise this is just a preliminary. It may provoke you or other investigators to move forward and do some more work, but it's early to come up with definitive conclusions. But otherwise, I congratulate you again.
Thank you, sir. Thank you.
Thank you all for a wonderful session. I will call upon Dr. Deepika to conclude the session.
Thank you, ma'am. Now, as we are about to conclude our session, I would now request our respected chairs, Dr. Sapar and Dr. Mohanty, to please summarize our presentation.
Go ahead, Dr. Mohanty. You're muted. You're muted.
Okay. Shall I tell, or do you like to summarize?
Yeah, go ahead. Go ahead.
I'll go ahead. So, Professor Sarfudin and moderators and coordinators, scholars who have presented their paper, and the participants who are looking up to us. This session theme was case reports, observational, pragmatic, and randomized control trial. So under this, we had new sub-theme was case reports, core studies, psychiatric neurodisorders. And here we had panel of speakers comprising of 8, and they have wonderfully presented their case records. I'm happy because it is a time of great opportunity. The premises of medicines, biological science, and technology are greater than ever before. The human knowledge and his development and disease from molecular to sociological, physical to mental has grown enormously from this study, it is understood. But restructuring is an academic perestroika. Absent of such perestroika, who will hamper any system. The basis of the structure is knowledge. Knowledge is knowing about, not knowing one have control understanding. The area known divided area unknown is always constant. Therefore, this kind of attempt, there are very successful attempts. We congratulate them, and there are some people who have neophytes. They have tried to build up. We also encourage them build up themselves. They can be tomorrow a good presenter. So in this entire presentation, so all these are more or less related to emotional, mental, and neurological complications. So these are all diseases, of course, may be very difficult to be cured, but the attempts are made very successfully by our speakers. I congratulate them and wish them all success in future. Thank you.
Thank you, sir.
Just maybe one word from my side, not only related to our session, but in general. I mean, we homeopaths, some of us are pure homeopaths, some are medical doctors or NDs and homeopaths. We're really very excited when we see a new case or a new finding and get excited and jump into present. It is good to know the preliminary findings, but if we deduce definitive results from our preliminary and limited number of cases, this would be misleading and would attract a lot of questions from the rest of the medical world. But otherwise, I congratulate all the participant speakers, as well as my co-chair, Dr. Mohanty, as well as our beautiful moderators.
Thank you, sir. Thank you for your seasoned advice, your valuable time, your wise words and viable feedback. So here we conclude this session. Thank you, all of you.
Thank you, sir.
Thank you.